questions.
So I have lots of questions about the Black Lung Program, but unfortunately, all the questions I have are in areas that are not under your jurisdiction, so I'll have to save those for somebody else.
Okay.
But there are a lot of things I think we can do to help Black lung victims as we move forward. So if I can ever be of help to you on that, let me know.
I very much appreciate that, and we will do all we can with from our vantage point as well.
Thank you. So let's talk 340B. Some of the nonprofit hospital systems, in my opinion, have been exploiting 340B program to reap huge profits that fuel expansion into affluent communities instead of continued reinvestment in communities of greatest need. In fact, my district is relatively economically stressed. We're 409th out of 435 for median household pay. So I've got for-profit hospitals that are doing a substantial amount, and my hospitals in my area that get 340B are using it, through my analysis at least, they're using it to help people. They don't have much choice, frankly. So it's a great program, and I support it. That being said, there are bad actors out there, and one notable example happened in Virginia, in what was then the district of my friend Don McEachin. And it appears that Bon Secours hospital system used the Richmond Community Hospital, which is clearly 340B eligible, to expand its use of 340B at the expense of Richmond Community Hospital and their patients in that economically stressed community. Over the years, services at the Richmond Community Hospital were cut and departments closed, while at the same time, Bon Secours, it appears, was transferring millions out of the Richmond Hospital to other hospitals within the system. Some in their system maybe even as far away as Ohio, I'm told. So, this is important to me. How do we make reforms? What exactly do you plan to do with the information that you all are collecting? I know you've sent a number of letters out to hospitals asking them how they're using it. What do you plan to do with that information when you get it? And if you don't get it, should we be passing legislation? I know I'm adding 2 or 3 things in there. Should we be passing legislation for more transparency? Because I made a promise to Don that I wouldn't let this go, and neither one of us knew he was going to pass away. He called me a couple of weeks before his death and said, hey, as chairman of Oversight and Investigations on Energy and Commerce, I need your help. I promised him I would help. Help me keep my promise.
Well, thank you so much for raising this issue. Thank you for your work on this issue. I had the opportunity to talk to him before he passed as well on this topic, and know how passionate he was about making sure resources are going to the places where they're intended. As you noted, 340B plays a vital role for some critical safety net providers, but we need to make sure that there's accountability and transparency in the system. Our recent letters to a number of covered entities were part of that process. Our request in the president's budget that we actually get specific designated authority for reporting, for covered entities to report on the savings from the program and how that's benefiting the communities they serve is a specific ask we have made in the budget. We look forward to working with you on that. We really would benefit from your assistance in making sure that we have all the tools necessary. As you probably know, we're in a lot of litigation on 340B, and so clarity about our scope and authority would be incredibly important to us.
All right, and I look forward to working with you on that. Let's switch gears and go to community health centers. Another group that does great work in my region. Glad to have them, but it has come to my attention in talking with some of my community health centers that pharmacy benefit managers are taking predatory actions against the health centers by effectively forcing them to sign what they believe to be unfair contracts. They're forced to sign these contracts, which include provisions which give the savings or a part of the savings back to the PBM, the pharmacy benefit manager, instead of helping the poor folks who really need these services of the health centers. So do you all have legal authority to address the matter? Or is this an issue that we need to, Mr. Carter and I need to put legislation in on?
I would
I shouldn't have left out Ms. Harshbarger.
Thank you. I would ask for your assistance here. As you may know, we also have had the issue of manufacturers not selling to covered entities via their contract pharmacy arrangements. We issued violation letters associated with that. That has been a source of considerable litigation as well. clarity about our authority and scope here to be able to, because I share your view that accountability in this system is critical and would love to work with you on that.
All right, I look forward to working with you, and if we need legislation, you've got 3 people on this committee that are more than happy to help you in any way you need.
Thank you.
I yield back, Mr. Chairman.
Thank you. The chair yields back.